Hello. Have you ever shared a room with someone that makes noise while sleeping? Noise like, well, if you have, what was the experience like? Were you disgusted? Were you embarrassed? Were you angry? Well, what were your reactions? Did you cover your ears? Or you try to cover your face with a pillow? Or you elbow the person? Or you try to choke the person with a pillow? Well, in this video we'll be discussing snoring, the mechanism of snoring. We'll identify different snorers and how to help them. We'll look at the risk factors of snoring and also appreciate the complications of chronic snorers. And at the end of the video, we'll be giving tips on the management and home remedies for managing snoring. Well, what is snoring? Well, it refers to snorting or rattling noise made by an individual while breathing that is associated with sleep. It is produced by the vibration of the soft palate and other soft tissues in the mouth, nose, and throat. It could be loud and frequent or faint and infrequent. According to Helen Reddy, the great musician and activist, she says, and I quote, "You are not going to see a man who saws don't get dirty and who doesn't snore." So does it mean everyone snores? Well, nearly everyone snores now and then. Let's see what is the mechanism of snoring. How is it produced? Well, the hallmark is narrowing of the airway. Once there is narrowing of the airway, airflow becomes turbulence. This turbulence will perturb the soft tissues, resulting in vibration, producing peculiar or characteristic sound depending on the tissue vibrating. What are the soft tissues in the respiratory tracts? Well, one of the major soft tissues there is the soft palate. Where is the soft palate? If your hand clean, you can put your hand just at the roof of the mouth and continue cleaning. Okay? In the outer part, you feel very hard part. That is the bony palate. I can hear you going in. You see a soft area, that is the soft palate. It's responsible for speech, breathing. It also aids to prevent food entering the nose when eating. These and other soft tissues like the adenoids, the uvula, play special roles in snoring. What are the different types? We have the mouth snoring. These are those that snore, their mouth is open. We have the nasal snoring. What is peculiar about the nasal snorer is that even while they are awake, they have problem in breathing. We have the tongue snorers. What is characteristic about them is that there's only when they are lying on their back. When they do that, the tongue falls behind, preventing laminar airflow, resulting in turbulence, producing snoring. Then the last, and one of the most important, is the throat snorers. In this case, in any position, they snore. One of the commonest causes of this is obstructive sleep apnea. Sleep apnea is temporal cessation of breathing several times during sleep at night, and it has been associated with stroke, diabetes mellitus, even atherosclerosis. It's one of the worst causes of snoring that may require immediate medical attention. What are the risk factors for snoring? Well, being a man is a risk factor. You see, men snore more than women. Is it true? The women will say yes, while the men will say no, yes. But based on research, men do snore more than women because they have a narrow airway. Another risk factor is overweight. When you're overweight, the excess tissues in the throat may impede airflow, resulting in snoring. There's a genetic factors. For those that have parents that snore, there's a tendency that they may snore. What are the causes? What are the causes of snoring? Age. As we age, the airway gets narrower, resulting in turbulent airflow, causing snoring. Overweight, of course, because of the excess tissue, just like the risk factors, causing narrowing, resulting in snoring. Alcohol use. Yes, alcohol causes relaxation of the soft tissues. There are also other drugs like muscle relaxants. They are also implicated in snoring. Pregnancy has also been associated with snoring because of pregnancy hormone that causes relaxation of tissue. So what are the management and treatment? One, we recommend weight loss for those that are obese or overweight, avoiding alcohol, treating nasal congestion if there is any obstruction, lying on your side while sleeping. However, snoring as a result of obstructive sleep apnea can only be managed using the following. There are oral appliances that help to keep the airway pattern, passive airway pressure. There is a room for upper airway surgery. There are different types. Example, uvulopalatopharyngoplasty, where they do a facelift of the throat, helping to leave the airway more pattern, preventing turbulence, eventually curing snoring. There is another surgery called the maxillomandibular advancement, where there is reconstruction of those bones, allowing a freeway for breathing. Radio frequency ablation of the excess tissues. And in recent times, there's this hypoglossal nerve stimulation that helps in allowing the tongue to fall forward, preventing obstruction. What are the home remedies? The home remedies for curing snoring. One, lifestyle modification. If you're overweight, one, you lose weight. Sleep on your side. You raise the head of the bed by at least 4 inches by treating nasal congestion, either with steaming or medications. You quit smoking. What are the coping and support mechanisms for snoring? You suggest some of the remedies as described earlier for your partner. If those remedies are not effective, then you can ask your partner to see a professional for proper management. When you are waiting, things that you can do is one, you can employ the use of earplugs or providing a background sound, good music to mask the snoring so that you can have a nice sleep. Thanks for watching. In my next video, I'll be discussing snoring in children and its management. Thank you.